Think of a number. Any number. Well, not any number. Make that a big number. A really big number. Think of over a billion. 1.2 billion, in fact. That's the number of people who live in India. This extraordinary country has no place for small numbers. When a virus makes inroads into a country like India, it can affect big numbers. In a concentrated epidemic setting like India, there was a need for HIV prevention services for most vulnerable population at scale and with quality. Thus came AVAHAN. A unique HIV prevention program designed by the Bill and Melinda Gates Foundation, together with many NGO partners from India. AVAHAN's goal is to build an HIV prevention model at scale that can be replicated and sustained.
We were obsessed with the notion of scale from the very beginning. Scale meant for us the saturated coverage of the groups most vulnerable to HIV. We didn't want to miss a single person who belonged to one of these groups. But what did scaling up really mean? It meant, first of all, intense field engagement. We didn't believe that you could manage HIV by sitting far away in an air-conditioned office.
To design the program for scale, AVAHAN identified 6 key states that accounted for 2/3 of HIV infections in India in 2003, with a combined population of 300 million, almost the size of the United States.
The AVAHAN project was initiated in India at a time when India was grappling with a huge challenge of HIV/AIDS. Clearly, some of the initial efforts were focused on treatment of individuals affected with HIV. But then it was also very necessary to prevent HIV/AIDS, and AVAHAN brought that into focus by bringing the high-risk groups to greater attention for public health action.
To fine-tune the design, the program distinguished various most at-risk groups. Indeed, global practices have shown that working with these most at-risk groups translates into HIV reduction among the general population. The program made certain key strategic choices during its design. To focus on select geographies and populations most at risks for HIV, to treat the solution as known and to emphasize the execution of scaling up, and create an active, aware consumer of HIV prevention services, and to design with the customer in mind, the community always being at the center of the program. To reach out to this large population at risk, the program needed to organize itself to achieve scale. Through their lead partners, AVAHAN reached out to over 144 grassroots NGOs and community-based organizations to tackle the epidemic. Now that's a lot of friends to work with. The role of the lead implementer in this organization was more than just administration of subgrants. They also played an active management function. Their responsibilities involved extensive field visits to oversee grassroots interventions, keeping provision of technical standards, on-site mentoring and training to solve problems and improve quality, and using data to inform future programming. Organising for scale meant managing for scale, and AVAHAN's virtual organisational structure was designed to enable rapid scale-up across geographies. To execute for scale, the project closely monitored the quality by creating the Common Minimum Programme. The team also spent months in the field, understanding the realities on the ground and helping solve problems.
Field visits help in understanding the situation on the ground in a more better way. They help in increasing the rapport with the community, and finally they give community the confidence that the project is with them and for them.
Peer outreach workers play a vital role in AVAHAN's strategy by identifying those community members who are at the highest risk and by providing support and information.
सबसे पहले मैं peer educator थी, तो मैं फील्ड में जाती थी और फील्ड में हमारे दीदियों को इस सब के बारे में जानकारी देती थी। सबसे पहले हमको जो एफएचआई ने ट्रेनिंग दी, उस ट्रेनिंग के हिसाब से हम अलग अलग फील्ड में काम करने शुरू किया। लेकिन जो हमारी दीदियों का खतरा है वो किस तरह से कम हो जाएगा, इसके लिए हम लोगों ने अलग अलग प्रकार के एसबीसी टूल जो है, एसबीसी मटेरियल, वो यूज किए।
412 program-funded free STI clinics provide diagnosis and treatment services at least once for almost 500,000 individuals.
Prior to the start of this project, we were seeing like the number of condom usage by the sex workers was comparatively less than now what we are seeing after the project has started. Now after condom usage and also advocacy and peer work where the sex workers are taught about the condom usage and also how to prevent sexually transmitted disease.
Condom distribution based on need is the underpinning of the programme. Peers ensured each community member had access to free condoms if and when he or she needed them. Highly successful multimedia campaign created awareness and helped normalise condom usage among the clients. Community mobilisation and empowerment paved the way for improved service uptake and sustainability. It is the hallmark of AVAHAN. The community is at the centre of the programme.
The AVAHAN model is an incredible model of success, both for other diseases in India where the community engagement, the scale up, the right approach where the strengths of the foundation and the strengths of the Indian government were brought together. And I also see that when we think about health challenges, whether it's AIDS or other things outside of India, I think the lesson should be learned there as well. AVAHAN shows that community engagement really can work. And in fact, not only can you achieve your primary end goal, like HIV reduction, you can create a sense of social equity, pushing back against violence, helping women move into a new profession, organizing microfinance. The overall benefits of that community empowerment done right can create a large number of benefits. And I think that's a very positive message.
AVAHAN with its scale has also developed community-led crisis response systems to address incidents of violence in communities.
तत्काल सेवा मुझे आस्था से जुड़ने के बाद मुझे मिला, और कैसे मिला मुझे, जो आस्था से जुड़ी तो ये जैसे अभी कोई दीदी छोटी माइनर है उसको मारते थे, घरवाली या काम नहीं कर पाती थी, तो उसका भी हम लोग मदद अभी करते हैं। और कोई अगर घरवाली मारा या प्यार वाला मारा तो उसको भी हम लोग अभी सॉल्व करते हैं।
In the process of building a high-quality, scalable HIV program, AVAHAN learned a lot from the experience. To define the agenda early, to be nimble and innovative, to engage communities, and above all, not to be afraid to make mistakes.
We've had some very positive learnings. We've learned how to work with communities, for example, to scale up HIV prevention. These learnings, I believe, go well beyond HIV. We are trying, some of these learnings are universal. For example, working with communities and community mobilization should be applicable way beyond HIV.
AVAHAN's concentrated efforts delivered remarkable results. In fact, the programme's biggest achievement is perhaps the very model that it has evolved in the process. To sustain for scale, the programme today focuses on transferring the custodianship of the programme to its natural owners, the various national and state level government organisations within India.
My job as UNAIDS to help broker the second phase of AVAHAN, which has been handing over the successful initiatives. AVAHAN never set up to replace government. It was here really to show for the global audience that prevention interventions could be taken to scale, they could be tailored to the different communities and the realities of the states and the country in which AVAHAN was working, but that this, if it was done properly, could actually make a meaningful impact on the HIV epidemic.
And then there's the most important and most endearing lesson of all. Dealing with big numbers doesn't mean that you treat a person like a number. What AVAHAN has proved is that when people come together for a cause, it does wonders.
मैं पहले अकेली थी, अभी मुझे ऐसा लगता है कि मेरे बहुत सारे फ्रेंड हैं और मैं अपने आप के लिए नहीं और किसी के लिए भी कुछ काम कर सकती हूँ।
इस प्रोजेक्ट के माध्यम से मेरा लाइफ चेंज हुआ।